The stress continuum model was developed as a visual tool for figuring out an individual's stress experiences, zones of stress, and stress responses. So, in other words, are they experiencing acute or chronic stress? What's being presented to you here is likely the most important information to know in this course. It will serve as a guide to understand stress first aid, as well as to become more self-aware of the signs and symptoms you and others are exhibiting due to stress. There are 4 zones in this model that allow us to understand how we and others are reacting to stress and how we're functioning when stress happens in our life. The first zone is the ready zone. The next is reacting, followed by injured, and finally the ill zone. When we are in the ready or the green zone, we are functioning at our best state. We experience growth through learning and we have overall wellness. We can say that we're experiencing healthy stress. It's this type of stress that we experience that does not bring on a threat or a fear. When we're in this state, we feel at our best in our control physically and mentally. We feel spiritually fit and mission focused. Now, when we are in the reacting or the yellow zone, we're faced with some sort of stressor. Now, that stressor could be small, like being 2 minutes late to a meeting, or it can be big, like an accident or a loss of a loved one. One thing to know is that no matter how big or small the stressor is, we will react to it 100% of the time. When a stressor comes our way, we will react to it 100% of the time. At that moment, we'll experience a distress. Now, that distress can be mild, it may even be more than mild, but it's temporary and it will go away. Now, within this zone, there is low risk for mental well-being in the long run. Again, it's caused by any stressor, and some of the things that an individual might feel include irritability or anxiousness, loss of motivation and focus, difficulty sleeping, and maybe some muscle pain and tension. Now, what happens after the reaction occurs? After we're in the yellow zone? Well, that's what this course is about. When we look at this continuum in the sense of acute versus chronic stress, acute stress lives in the yellow zone. It's the reaction or response that we have to a stressful event. However, if we do not have the tools or mechanisms to either remain in the yellow zone or that reacting phase and eventually move back down to the green and ready, we're going to remain in the yellow and eventually move up to orange, which is injured, or potentially red, which is ill. Now, orange and red, that's where chronic stress lives. So the injured or orange zone is a zone someone is in when the stress is more severe or it's persistent. The stress leaves this emotional scar within us, and there's higher risk to our overall mental well-being. Now, this is caused by the stress injuries that were addressed earlier, and they're a result of traumatic injury, grief injury, moral injury, or fatigue injury. And this is a state where we begin to feel that loss of control, panic, rage, or depression. We don't feel like our normal self, and we feel a sense of guilt or shame or blame. This is also where we see unhealthy behaviors that can often be seen as misconduct occur. And when stress injuries are not taken care of, when they're not identified and treated, when they're not addressed and instead buried so we don't have to see them, illness eventually occurs. Because at some point, whether it's days, months, or years after moving, or just moving it aside and not intentionally addressing it, the injuries can resurface, leading us to become ill and potentially diagnosed with a clinical mental illness or a diagnosis or life impairment, because all of it will have been a result of unhealed stress injury. We may see this in the form of PTSD or depression or anxiety, and it gets worse over time. Severe stress is noted, and social or occupational impairments can be seen. So it's not only the stress continuum developed as a visual aid, For looking at individual stress responses, it was also designed to reduce stigma by showing that people can go in and out of ranges of stress reactions frequently based on many factors. Now, stress first aid was designed to help folks identify when they or someone around them was showing symptoms of being injured due to stress, and to move themselves or their coworkers from the orange zone back to the yellow or the green zone, while also providing tools to prevent us from moving into the orange zone at all. Now, I do want to state here that not all diagnoses of mental illness are related to stress. This is just showing how stress can eventually lead to illness if not addressed over time. Now that we've learned more about the stress continuum model, I invite you to take part in a meditative exercise before moving forward with the course.